Hi, good afternoon, everyone. My name is Dr. Gauri Kulkarni, and today we are going to talk about a very important topic, something which is something which is topical. It is something that we have to do for our parents and for the elderly people in the community, and hence it's important that we know more about it and talk about it. So today is the World Alzheimer's Day. It's the 21st of September, and we usually celebrate it as the World Alzheimer's Day. September as a month is celebrated and in terms of making people more aware about what is dementia, right? So it is also known as the Dementia Month. And today we are going to talk about dementia and Alzheimer's and about what we can do as individuals to help elders in our community understand and help them cope with this serious illness. It is an extremely debilitating illness and can be difficult not just for the person who's suffering from it, but also for people who care for patients of Alzheimer's and dementia. So before we start off, of course, if you have any questions, do come up and ask the same. In the meantime, let me just introduce myself. My name is Dr. Gauri Kulkarni. I am a practicing family medicine specialist. I've been practicing in Bangalore for more than 15 years. And, one of my chosen fields and something which I love doing is to take care of the older people in our community and to take care of their issues, right from chronic disease management to even the topic that we are concerned with today, and that is dementia, and more so about Alzheimer's disease, right? So if you have any questions, do ask about them, and I'll try to answer them to the best of my abilities. But in the meanwhile, let me kind of come back to you and try to make you understand what is this word dementia and what in specific is Alzheimer's disease, right? So I'm unsure if you kind of know about what dementia is, but it's basically what we call as a collective term that we use for um, a progressive degenerating brain disease, right? So when I say progressive, it means that something which is going to get worse by the day. It's only going to become worse, right? So that is something that we have to understand. It is degenerative. What does degenerative mean? Something wherein the cells are dying, right? So the cells are not having the capacity to work, right? So they are degenerating. And of course, it is concerned with the brain or the nervous system, and hence, it's a collective term which is used for progressive degenerative brain disease, right? Now, dementia, of course, what it does basically is because of this degeneration process that happens in the brain, it affects all the functions of the brain, right? It affects memory, it affects our thinking capacity, it affects our moods and behaviors. So, in all faculties of where the brain is working or brain is required, it kind of starts affecting. Now, this is a very, in certain times, dementia is a very slow progressive disease, but in certain kinds of dementia, it can be quite fast as well, right? Now, Alzheimer's disease is a type of dementia, right? Now, dementia can happen because of many other reasons also. If you've heard of what we call as vascular dementia or Lewy body dementia, or sometimes alcohol related dementia. So, dementia can happen because of many reasons. Alzheimer's definitely is the most common of them, right? And this is usually seen in individuals who are above the age of 65, right? And its onset is seen there. But there's a new term which has come, which is called as the early onset dementia, or basically the presence of symptoms of dementia in individuals less than the age of 65, which means it's a very early age that it has set in, and definitely can cause a lot of uh, you know um, um, it can cause a lot of affection, not just to the individual who's suffering from it, but also for the family members or caregivers who are with the individual, right? So it's important for us to understand that. Now, there's nothing like there is a social boundary or economic boundary, right? Dementia can affect anybody. It can really affect any of us, and every person's experience of dementia can be very different, right? So but the whole thing is, because it's a progressive disease, it will lead up to a place or a time in the person's life when they are unable to care for themselves, right? And that's the most important thing that happens, that they are unable to care for themselves, which means aspects of daily living, like say simple things like bathing or brushing, or clothing yourself, to keeping yourself clean, use of bathrooms, even the use of your motor activities of your hands and legs, to see complex augmentation activities, such as going to the market, or going to the banks, or doing any of the activities which are regular tasks for people. And dementia leads to a place where one is not able to care for themselves, and hence it is quite debilitating. It puts the person down to a place where he or she has to be dependent on someone else for their care, right? Now, in terms of cure, of course, there's no specific cure that has been found. There are medications which are available which slow down the process, but that also depends on how the diagnosis has been made. A lot of times, and I keep saying this, right? A lot of times, as people, as we grow old, we attribute a lot of our things to aging. So forgetfulness is common, and a lot of all of us as well forget. But and one grows old, one tends to attribute it to aging, but many a times that might not be the case. That might be an early sign of something to do with dementia. And I think it's important for all of us to understand that and be aware of it, because I think unless we are going to talk about it and discuss about it, we will just brush it down in the garb of saying that it is because of age, right? Which is not true, really, many a times, right? So I think it's very, very important for all of us to talk about it. And I think the theme for this year is also talk about dementia. I think it's important that we start talking about it, tackling the issues that it brings in, because there is definitely a lot of stigma attached to it, because the person is not able to care for themselves. So a lot of people do not open up about the fact that they are suffering from such an illness, and even in its mild stages. I think it's important that one talks about it, the caregivers talk about it, and just normalize normalize that this is a disease process, right? And encourage people to find more information about it and seek more help about it. I think that's really, really important. The reason why this happens is also because I think as one gets into the phase of dementia, there is the sense of self is lost, and with it there's a lot of self-respect and self-esteem which is lost, and that leads to a lot of emotional and emotional issues with patients who do suffer from dementia, and they understand it as well, right? So I think it's important for all of us to know that this is a problem that we must be aware of, that we talk about. Also because we are now, we are all growing, the population in general is living longer, and we are growing older and living older for a much longer time, and hence it becomes even more important that we talk of geriatrics and old age issues a lot more, so that we can kind of help and bring in the changes that are required for people to have a more productive life, post 60, 65, right? Once their retirement happens, because people are tending to live for a good 20, 25 years post their retirement from work, and that's a huge amount, a huge chunk of lifetime that is still left in them, and they need to live it in the best form possible, right? Now I think it's important for all of us to start understanding what are those signs of dementia that we look out for, right? Like it's important for us to understand um, when do we seek help, right? So I think one of the things that I usually say is memory loss, right? So you're becoming forgetful, and forgetful about things which you normally won't see, being things that happen in the morning, or the recent memory which is getting affected, or like where did I keep my keys, or what did I do. These are the things, forgetful, being memory loss or forgetfulness, I think is a sign that we should be looking out for. The other thing that is also that people have a problem with, say, keeping track of things, right? So what happened, in terms of I did 1, 2, 3, 4 activities through the day, but they are not able to keep track of it. So that is also something that may show up in patients who have dementia issues, right? The other thing is also say difficulty in performing familiar activities, something that I was very something that I could do very easily, but I'm not able to do now. Like say simple things like buttoning shirt or unbuttoning. These are things which were in my memory and learned, but now I'm unable to do it. So that is also a sign that there is something more happening there. I think also few of the other things that people with dementia also suffer from is say lack of judgment. They're not able to have poor or decreased judgment about taking decisions for themselves, right? You will also see things like as the disease progresses. I think it's also something which is very commonly seen is say issues with mood and behavior. In early stages it does happen quite a bit, and I think it's important that that needs to be addressed very well. Many of them might have anxiety as an issue, depression, low self-esteem, because many of them may also be knowing what the problem is, right? Many of them might be also knowing say that they are suffering from a irreversible progressive disease, and that can make one feel very low and anxious at the same time, right? The other things that can happen is, see, because of the mood issues, there can be behavioral problems also. A lot of times people with dementia tend to be very agitated because they on one hand they're aware that there is a debilitating disease that they are suffering from. On the other hand, they're unable to do their activities, and that can bring in a lot of agitation, anger as well, and behavioral problems. I think one of the other things that also happen is because of these mood changes and behavioral problems, there can be in some people there could be something called a social distancing, or the social withdrawal. Like people who suffer from dementia sometimes become recluse, right? They keep to themselves and they're not open to talking or going out and meeting people. And those are also, that can also be a sign of something not looking good in terms of dementia. And I think it's important that we acknowledge that such symptoms are happening, and uh, uh, try to see and get to a diagnosis if that is required, right? So I think it's important that these are few of the signs that we do understand, we do work on, and if we do find any of this in people around us, right, especially parents, right, it's important that we seek help, right? A lot of times diagnosis is made based on assessment and also based on certain imaging techniques like CT, MRI, which are done to see how the brain is looking, and then the diagnosis is made. So, as I said, that dementia could be of different kinds, right? Alzheimer's is a type, but then there are other forms which can also be there. Say there's something called as vascular dementia, there is frontotemporal dementia or Lewy body disease, or dementia because of other chronic neurological problems, say Parkinson's, are known to have dementia as an issue. So I think the diagnosis has to be made correctly. There are definitely certain medications which can be given, which help in reducing the what can I say, the progression of the disease, right? So it is possible to kind of reduce the intensity of the progression, and that can be done by giving medications. But however, these medications have to be started very early on, because as the disease progresses, I think the effect of medications also won't be as much, right? So I think it's important for us to understand that and take action early on, and hence the reason that early diagnosis definitely helps to some extent to give a better quality life to patients who suffer from dementia, right? So I think going on to the next thing is, the first question that most people ask is, okay, so it seems to be a progressive disease, it seems to be an irreversible one. What can I do to not have it, right? And yes, that's a very pertinent question. We all would not want to have diseases, we all want to be healthy. But in terms of dementia, as I mentioned, there are no boundaries, right? There are no boundaries that everybody can get affected with this, okay? But I think there are a few things which we can do to ensure that we minimize our risk of, say, developing dementia, right? So one of the most important things that we keep saying is these all need to be started very young in life, right? You can't turn 60 and then say, now I'm going to take care of myself and ensure that I don't get dementia. No, that doesn't work. We need to start doing the right things very early on, right, in our 20s and in our 30s, to ensure that we take care and reduce the risk of development of dementia, right? So one is definitely, what we keep saying is take care of your heart, right? And this is important not just from a health of the brain perspective, but the overall body health. Now, why is that, right? So we have to look after the fact that we take care of our heart, because if the heart is pumping well, there is enough blood supply going to the brain, then of course the brain will function better, right? So things like, which will affect your heart, right? So that brings us to ensuring that our blood pressures are under control, our cholesterols are under control, any of all chronic diseases, say be it diabetes or say overweight, being obese, obesity, all of these can lead to damage to the blood vessels, and then they can increase the risk of having a stroke or a heart attack, and that can contribute later on to the development of dementia, right? So it's important that we take care of our heart. Now, one of the most important things that we talk about here is definitely looking out for avoiding or stopping smoking. I think that is one of the most important things that have been spoken about when it comes to not just dementia, but with a lot of other diseases as well. So ensure that we take care of our heart very well. I think that's the number one step, I would say, if we had to reduce our risk of getting dementia, right? The other thing definitely is to keep ourselves fit and keep ourselves physically active, is how I would say, more than fit. I think it's we have to be physically active. Why? Because when we exercise or we are physically active, we tend to, it also helps in controlling blood pressures, exercising our heart well, it keeps our weight under control. All of these things are good because they help in increasing our blood supply to the brain, reducing the risk of development of dementia by that, right? So these things kind of go hand in hand, and these are more from a good lifestyle perspective and also from a perspective of, say, dementia, right? The other thing, of course, then the next step for lifestyle is ingestion of healthy diet, right? So we have to take care, because the fuel that we provide to our body is also the fuel that you provide for your brain as well, right? So it's important that we give ourselves the right kind of nutrition, which will help us in keeping our body, mind healthy for a very, very long period of time, right? So those are some things which are a part and parcel of our life for any disease, and not just dementia. So I think it's very, very important for all of us to remember that, and to keep working around our, taking care of our lifestyle, right? So the other thing that definitely, I think one of the things that we keep saying is to challenge our brain more, right? So one of the things that has been said over and over again about dementia is people who tend to use their brain more tend to, not, or challenge their brain more, tend to, have a lesser chance of development of dementia or memory issues, because there's a concept called as increasing the neural connectivity in the brain. So the more you challenge your brain, the more you use your brain, it helps in development of these new neural connections, and hence reduces the chance of getting dementia, right, or any of the memory issues that we are talking about. So I think it's very, very pertinent for all of us to think about how we can challenge. Now, there are different ways of doing this, right? Like, there are people who talk about, say, using of brain math, or brain teasers, or say doing some kind of verbal or numerical puzzles, which will help to keep your brain kind of going, and ensuring that it is kind of, the computation is happening on a long period of time, right? So that is very, very the other way of challenging your brain could also be, say, learning something new, or hobbies, or learning some kind of, say, creative activities, which could be anything, which will stimulate your brain into working better, right? So those are the things that you can do to kind of challenge your brain more and keep it more active. I think the last but not the least, I think I keep saying this also, one of the things that we have to do to reduce our risk of getting dementia is to improve more social contacts. I think we are all social animals, and the more and more social contacts that we have, it also helps in stimulating our brain. It helps relieve depressive symptoms. It helps in release of good hormones in our brain. So enjoying social activities, making new friends, making new connections, making new relationships, I think these are very, very important. These are some of the few things that we can do to ensure that we reduce the risk of, say, um, developing dementia. So, as I explained, right, you take care of your heart, ensure that you have a physically active life, eat the right kind of food, keep challenging your brain, and definitely have a lot more social, enjoy your social activities more than, having a lot more. It's about enjoying it and creating new relationships and connections to help, keep our brain supple, keep our brain active, and keep our brain strong. I think that is, that's very, very important, to, take care of, our, take care, so that we can reduce the risk of developing dementia. There is a question which somebody says, what do we do if a suspected patient is adamant and we cannot take them for a diagnosis? I know that's very difficult. And most people are, they do feel that, right? Because I think it's also to do with the stigma that is attached around the disease, I feel, because people, they do not want to accept something like this, right? So one of the things that we can do, to help the person is, to come in touch with the reality. There are certain, questionnaires which are available, where they are more like a self-test questionnaire, where the patient can actually, take these self-tests, which is, um, which help them to understand, if they are really, um, having a memory problem, or is it just, say, I'm forgetful. Okay, so there are certain tests that are there, which are called as cognitive function tests, which are available to kind of, for a person to be, to take it, to understand if the output does show that there is a risk that there could be something more happening than just a forgetfulness. I think it's a good idea for you to, maybe through a play, kind of, present it, to this person, and, followed by that, maybe taking the person to, one of the things I keep saying is, maybe, the person, taking them to a doctor who they are very comfortable with, right? So a lot of times we think of, when it is a brain problem, go to the neurologist. Yes, you have to go to the neurologist, but many a times, the patient or the person who is suffering from it might be comfortable with, say, going to their local GP, because that is the person they have been meeting for a very long time. So maybe the first barrier to break is to just get them to their local doctor, who they are more comfortable with, or their regular treating doctor, and then maybe the doctor can broach that topic, get self-test evaluation done. Also, it's important that patients who do suffer from dementia are kind of taken care of from their physical health perspective, right? So as I mentioned, that a lot of them may also be having chronic diseases like, say, diabetes, hypertension. A lot of times they suffer from vitamin deficiencies. It's very well known that if there are thyroid problems, or there is, say, vitamin B12 or a iron deficiency, patients can tend to have, forgetfulness, which has nothing to do with dementia, but to do more with the deficiencies. And I think it's important that maybe you could take the route of, say, initial investigations, self-test questionnaires for dementia, and, say, getting it through the GP, the patient is comfortable with. I think these are the three things that I can kind of, more like a pointers that you can try to, try to convince. And I understand that it's not easy, because nobody wants to take this diagnosis, right? It's not something which we, it's not something that we, like listening, that I'm going to have a debilitating disease and I do not know what's going to happen tomorrow, right? So I think that's very, very important for all of us to first, understand that, yeah, this can be difficult, this can be very, very difficult for a lot of people. And I think, as long as we, we empathize with them and understand them first, I think then is the next step to be taken, right? So, as I was mentioning, right, so, a lot of times, as I was mentioning, that the issues that dementia brings up with is not just about forgetfulness, but about things like, they are unable to plan, or the logical thinking is lost, or the sense of judgment is poor. And a lot of mood problems can come in, which can be very difficult. And as a caregiver, I think it can be very, very um, difficult to accept it as well, because many a times the caregivers are children who have seen their parents in their heydays, and seen that they are doing so well, and now they have to see their parents in a different light, and that can be very it can affect the caregiver as well. So if you are a caregiver, I think it's very, very important that you also take care of yourselves, right? As you're caring for your parent, or as you're caring for a loved one who is suffering from dementia, it's important that you also care for yourself and find a outlet where you can talk about your struggles of taking care of this person, and what you are feeling from an emotional standpoint, because this is important. Because if you are suffering, then you would not be able to care for a person with dementia, because it's a long struggle, and it can be a battle as well, because it is a progressive disease. And though initially it might be mild stage and mild symptoms, as it grows, it can reach a place where there is complete dependence for every functionality outside of oneself when it comes to dementia. So it's important that we kind of, as a caregiver also, we talk about our trials and tribulations going through this, right? So I think it's very important for us to understand, how do we empower a person who is suffering from dementia, right? I think it's important that we do not look at this as a disease which is the end of everything. I think, we tend to do that, right? When we the first time when I when somebody say defines it as something which is progressive and degenerative, we know that there is definitely an end point to this, right? It's only going to worsen. But that doesn't mean that we are not going to work on things which can be worked on, right? So I think the first step is to understand which level. So once the diagnosis has been made, and say suppose the person is known to be in the first or the mild stages of dementia, I think apart from the medications that the doctor would start, right, neurologist would start, I think there are a lot of things that we can do from a home care perspective, or from a perspective of helping the person to be as independent as possible, right? So because that also gives a sense of self-esteem for the person who's suffering from dementia, and it also gives them that courage that they can still be themselves, right? So I think it's very, very important for all of us to understand this, right? So I think the first step is to empower them for their activities of daily living. When I say activities of daily living, it could be, brushing their teeth and combing their hair, bathing themselves, dressing themselves, feeding them, eating by their own self. So these are basic activities of daily living. And I think in mild stages, it is very, very much possible that the person who is suffering from dementia can still take care of themselves in all these spheres, right? So I think it's important for us to help them in this, right? So make it very easy. I think familiar environment is something which needs to be provided for people who are suffering from dementia, because it definitely helps them to um, assist them in their activities of daily living, right? So the rooms should be the same, or the bathroom where they go to have to be the same. They need to is the same area there, or the same house that they're moving around. So if we keep changing their location, they do tend to get confused, and that can be difficult, right? So one of the things, one of the simple things that we can do is to maybe create a checklist for them. Like, you could have a whiteboard which says, these are the activities which have been done, and if they have done, they can tick it, so that they know they may not forget. A lot of people who suffer from dementia tend to forget, right? So they may have brushed their teeth, but they would want to brush again because they don't remember they have. Or so they may have had their tea, but they don't remember, and they would ask for another cup of tea, right? So it's important that maybe creating a checklist, right, with a big board with boldly written words, if the person can read and write, then this helps to kind of have a better understanding for the person who's suffering, and also for the person who is caring for the patient, right? The other thing is also, sometimes it helps to kind of create like a what can I say, a procedural chart, right? When I say procedural chart, what do you mean? That, how to brush your teeth, right? I think it's important for us to kind of give that, right? So it could be simple chart which tells them this is the way to do it. And I know it sounds very cliche, but it will go a long way in keeping the person as independent as possible. So I think it's important that we do create procedural charts on how to brush or how to comb or how to button unbutton, or simple things like that, right? So it really really helps to keep the person very very in as independent as possible, right? The other thing is then, one side is activities of daily living, but I think also in mild cases it's important that we also try to empower people who are suffering from dementia in terms of, say, taking care of their um, shopping, or say their banking or money matters, or how they can, say, still reach out to other people by calling. These are the things that we can kind of um, assist to help them to be better, right? So most of the times these, people with dementia should have somebody around them. It's always recommended that they do not step out on their own or alone if the diagnosis has already been made, because there is a chance that they may lose their way, or they may not know how to get back. But if they have to, then I think it's always important that on the body of the person who has dementia should carry a card which tells the person's name, age, what is he or she suffering from, contact numbers, emergency contact numbers, blood group, these kind of like a small kind of chit, or a card which is created, and it should be on the person's body, because I think it really really goes a long way, because you never know when things can be when things can suddenly change, and this person might be out alone, and you do not, and may have forgotten and doesn't know where to go, and that can be very very disheartening and sometimes very painful to us as everybody as well. So that is something that you can help a patient with mild illnesses. A lot of times people do not understand, like, as time goes, they may have difficulty in orientation, right? So they don't know where they are, or what is the time of the day, or who the person around them is. So it's a good idea to kind of have large calendars with large numbers written on it, or a clock which is easy to read, right? Not too much of jazz on the clock, more like numbers, like numericals written, rather than, say, Roman numbers, which is difficult to again perceive or understand. So like simple 1 2 3 written, a big clock which tells the time correctly. I think those are the things, calendar and time, I think helps the person to be more oriented. A simple thing like is important is that during daytime ensure that the place where the person suffering from dementia is, you have the curtains open, you have sufficient light coming in, so that they understand the concept that it is day, right, versus the night. Because a lot of times it happens is that there's a concept called as sundowning, which means, as the day progresses, the person tends to get more and more confused, because they are not able to understand day from night, and their confusion can lead to even agitated behavior as well. So it's important that day night change is constantly present, and the person understands that, right? So we try to create that environment for the person suffering from dementia, to give them a more better clarity, or rather better orientation, right? A lot of course, it is going to happen that they are going to forget people around them, right? So disorientation can be about the time of the day, but it can about the place that they are, or about the people around them as well. So I think it's important that there are fewer people, and the same set of people who are around a patient who suffers from dementia. How does that help? Because they will most probably have that better in their memory, rather than having too many people coming in, because that can lead to a lot of confusion, and sometimes even, feeling of, they may feel very challenged and sometimes very threatened as well if there are too many people coming around. So keep minimal number of people who are interacting with the patient with dementia, and ensure that that interaction happens regularly, so that they can remember these people, right? So that is something that you can do. I think in the house itself, if the person is still mobile, many times they get confused, where is the bathroom, where is the bedroom, where is the kitchen. I think it's important that in a lot of places we also recommend that you label these, right? You could put these labels on the door, or put, say, signages which the person may understand. Like, for example, you could write the word kitchen, or you could have a picture around about the kitchen, say a gas stove or something, which the patient can easily understand or does know about it already. and then so that the patient understands, oh, this is the kitchen that they are going into, right? This takes, see, this goes a long way. These sound like very trivial things, but this takes you a long way in providing the kind of independence that I think a patient suffering from dementia um, needs. I think everybody needs that dependence, and nobody wants to be nobody wants to be dependent on someone else. So as much as possible, we need to provide that independence to them to be able to function on their own, through the day. So say labeling, as I said, helps a lot. In mild cases, we still recommend that patients should do brain activating exercises, right? So a lot of people do, reading newspapers, or say doing certain numerical puzzles, or say sudokus, or say doing jigsaw puzzles together, or solving crosswords, anything which helps the patient to um, stimulate their brain to work more, right? At a level where they are able to do it. A lot of times, if we give some stimulation which is very, very complex, of course, it can make the person agitated, because they already are feeling incapacitated about the memory problem that they have, if they understand it. And then that can lead to more agitation. So give something which is doable, but which also keeps their brain, active. So I think that is very, very important for helping them. Now, in terms of calling, there are a lot of mobile phones which are now available, which have bigger numbers and bigger fonts, and I think that really helps, because the smaller mobile phones again will, and give them something which is basic, so that there are not too many functionalities that they have to work around with. It will be something which is very, very easy to understand and very basic, right? But it takes a long way in keeping them connected, keeping them available, and at times when maybe they are left alone, this can be a very powerful tool as well, to even track them and understand where they are if they are lost. So I think that is something that we can do. I think there's one more thing about what we call as reality orientation, and this is very commonly done with patients who suffer from dementia, is to tell them what's happened and what is not happened yet. And hence the thing that I spoke about, checklists, right? So maybe having a board or a sheet which has things that they do on a regular basis written, and then get them to tick it the moment they have done it, right? If that is not possible, the other thing is, like, simply um, see, if they have had a cup of coffee, then keeping the coffee mug by their bedside, for them to know that they have already had their coffee. So it's an empty cup of coffee which they have finished, or the food, a plate of food, which is finished, the unwashed plate of food, because then they understand that this is done. A lot of times, otherwise, that leads to repetition of activities which may not help patients suffering from dementia, right? I think one of the major things that also we have to work around is mental health in such patients, because it can be very difficult. They can suffer from low self-esteem, low moods, depression, anxiety, feeling agitated, and these can all be because of a place stemming from a fact that in milder, or early stage of the illness, people do understand that they are suffering from an illness, but at the same time, they also uh, you know they also tend to want to not look at it, like they are in denial, and hence that becomes a problem. And early stage symptoms can be very, very uh, uh, you know, uh, very varied as well. A lot of times it can just present as forgetfulness, right? Or forgetfulness, or something which think inability to complete a task which they would normally do, right? So somebody who has been doing Sudoku for years, and now they're not able to finish it, right? They're not able to get through it. I think that can be a very uh, classic symptom of an early symptom of the disease. One of the other things that can also is, a lot of times they also try to make up stories, right? Because I want to cover up my forgetfulness, right? People tend to do that, right? Because so I know that I'm forgetful, but now that I've forgotten, I would rather end up making up a story to back that forgetfulness. And that can be some of the things that you can observe as behavioral or changes in early stages, right? So other thing is also a lot of mood problems, like they get very agitated because again they are forgetful, right? The other early stage issues can also be things like poor judgment, right? They're not able to judge, say spatial orientation can be a problem, not able to understand, oh, should I cross the road or not cross the road, and getting into probable accidents because of that. So those can be early symptoms or signs. However, diagnosis is done based on assessment done by a neurologist, and depending on, and of course imaging that we do, and followed by medications if they are applicable in certain patients, right? So I think it's a combination of how we can diagnose it that way, right? So as I said, right, I think one of the things that majorly have to be looked out for is mental health issues. A lot of affirmations, I think it's very very important for us to encourage patients with dementia to try to be as independent as possible, patting their back and encouraging them for being able to cope with the situation, reassuring them that they are doing a good job. I think that really really helps, because a lot of times, you know uh, that social withdrawal itself, because I am not able to remember, and so what if somebody knows this, and this can lead to social withdrawal, but that really makes it even worse, because of social withdrawal. They will not be interacting. When they are not interacting, there is not enough brain stimulation, right? So I think it's very important that we engage people with dementia to be as social as possible, help them in understanding, um, uh, that this is a part of a disease process, right? But it doesn't change them as what they are, or it can lead to, say, low self-esteem also, and make one feel very, one can get into anxiety and depression because of this. But I think constant encouragement, say constant reassurance, and also giving them tools to be able to independent through the day, I think will take a long way in making them understand that this is something that can take them ahead on a regular basis, right? I think, and hence it is important to have support groups, right? It's important to have, say, old friends that they call regularly, or people that they are familiar with, to be interacting regularly, having a family time regularly, and sitting with them and talking, and spending that time to um, engage them, I think is very very important, to have a more have a better quality of life. I think that is very very important, that we stress upon a good quality of life, because, see, at the end of the day, a lot of these patients would also be having other comorbid conditions, right? Like that they may have, say, diabetes, or high blood pressures, or heart problems, and there can be multiple drugs that they're already on. And hence I think it's important that we kind of work in unison, to help the patient to be as independent as possible, right? There's somebody who asked a question, saying that I tend to forget names. Does that mean, I mean, and take time to recollect? See, most of the time, a lot of us have issues with forgetfulness, right? But if we are able to recollect, right, recollection is a way in which we actually simulate a part of our brain to recollect things based on, say, our ability to make those connections between the name and something else that happened, right? So if you're able to recollect, usually that would not be a kind of a diagnosis of Alzheimer's. However, I think it's a very good idea for us to understand your age, and things like, do you have predisposing factors, or risk factors which will lead you to it? But I think a very common reason for what we call as reversible dementia could be certain deficiency, vitamin deficiencies, thyroid issues. So it's a good idea if you have had a long term, or even for that matter, depression. So if you have had forgetfulness as an issue, maybe get yourself checked from a perspective of things which can be treated, right? It could be very something very simple, and leading to forgetfulness. And if that is not the case, say for example vitamin deficiencies, B12 deficiency, thyroids, depressive symptoms, if these are not there, then maybe you should talk to a neurologist once. But I don't think it sounds like Alzheimer's to me, because you're able to recollect well, right? um, so I think there is nothing to worry as such. I think worry makes it even more difficult, because I think anxiety makes us kind of more forgetful. So I think we need to work on our mental well-being, definitely. So I think it's important for all of us to kind of understand that this is a problem which is there to stay with us, right? We are all going to, as young individuals also, we are all going to grow old at some point in time, and this is something that can happen to everybody. So on one hand, we have to take care of individuals who are already suffering from dementia and different forms of dementia like Alzheimer's. But also, I think it's very, very important for us to know that we can also be at some point in time suffering from it. And what can we do to ensure that we do not increase our risk of getting dementia and forms of dementia? I think that is what I would leave as a takeaway, right? So on one hand, how do we take care of people who are already suffering? But also on the other hand, how do we take care of ourselves so that we don't um, increase our risk of getting dementia and different forms of dementia? I think that's very, very important that we all understand this, work towards it. Of course, if you have any more questions, you can always reach out to me. I'm always available to answer any questions. If that it's not the case, just reach out to your regular doctor, be it your local physician or online, and I'm sure that they would be there to answer all your questions and take care of any doubts that you may have. All right. So take care of yourself. It's the COVID times. Ensure that you stay safe, wear your masks, wash your hands regularly, keep away from crowded places, and stay happy, stay healthy, and stay safe. All right. Take care and goodbye. Thank you.